3, 2. Hello, you are listening to Finding My Way. Today we'll be covering health promotion and disease prevention, a BS degree offered at USC through the Keck School of Medicine. Here to tell us more about it is Gianna Marino, a junior from Marin County, California. In addition to a full course load, she's an RA, a member of Greek Life, and a Keck student ambassador. Gianna, I'm excited that we finally made this happen after a few months of just trying.
We've tried and we've finally gotten here, and I'm very excited.
Look at us.
Look at us.
We've made it.
Look at us.
Alright, so for those of you back home, Gianna is in a similar major as me. She is in the health promotion disease prevention major, while I'm in the global health at USC through Keck. They are the two bachelors of science degrees offered through the Keck School of Medicine, and they're basically sister majors, so we know each other very well.
Yep.
Gianna, I have to ask, very first question about health. Why did you choose health promotion and disease prevention?
So originally I was a global health major. It was very IR heavy, and I took an econ class and I was like, I don't know if this is exactly what I want to be doing, so I looked into health promotion. There was a lot more HP classes, so you could take like non-IR classes, and I said, that sounds great. But in general, I got into public health and global health more in high school. I was originally always wanted to be a doctor, so I went on service trips in high school, and I did some work in Bali, setting up free healthcare clinics and everything, and in Costa Rica, some more free healthcare clinics. So it was always something I've been very passionate about. And like as a kid, my family and I would use free healthcare clinics, and seeing that treatment and the treatment I go through and like everyone else goes through was pushed me into public health for sure. So
wow. So it was something that kind of grew from very early on in your childhood,
right.
That you always saw health as this bigger picture thing.
Right.
Really?
Yes. When you're a kid and you go through the free healthcare clinics, you get a sense of how the systems work and you see what issues are in them. So growing up, I knew the problems in them. You can identify them. It's doctors not wanting to take the time with you or rushing you through, or the long hours waiting at the clinic. So from a very young age, I was like, this is what I want to do. I want to fix these problems so no other kids have to go through this treatment. So that's why I did more global health work in high school, and then decided that being a doctor wasn't for me, but still applied to the HP major because life's work is going to be public health.
Oh, it's very admirable.
Thank you.
So when you were in high school, what kind of things did you do that were global health related? I know you said you went out of the country and you did those things. Were those through the school or through other things that you found?
Those were my mom actually found a program on Facebook, and I know it's one of those ads. She was the consumer. She bought into them.
Just Facebook ad first, send your kids to another country to help different health systems.
Exactly. So she showed me the ads, and she's like, we can't afford them because it's very expensive to go out of the country, of course, staying there for 2 months and flights and everything. So I got a waitress job, and I saved up for years to go on these trips, and that's how it was. But it wasn't through school. It was a leadership program, but it was very legit. I'm still here to this day, so it worked out.
There you go. Nobody kidnapped you.
Nobody
You're
kidnapped
okay.
me. Thank God. So, no, it worked out.
Okay. So those were some of the things that you did in high school. What else did you do? And if you don't mind me asking, what was your GPA like as well?
Oh, in high school, I went to an arts high school, actually.
Arts high school.
So I was in jazz band and everything like that, played like 5 different instruments in high school. I also did Irish dance. So these are more cultural, fun things I did. For public health-wise in high school, I did volunteer at a humane society, so kind of like a pound for like animals and such, like guinea pigs. Great experience. I didn't really do much hospital work, more so just the experiences over summers I would go abroad because it was too busy during the school year.
Yeah.
But in high school, I did have a very good GPA. It was like 4.5 or something in high school.
That's insane. So it's just like all APs then?
Yeah. That's why I didn't have much time for anything except for fun things like Irish dance or music.
How did you manage that?
In high school?
Yeah.
I don't know. I question that now as I'm doing my work.
Is your sanity okay?
Yeah. It's being first generation. My parents are both immigrants, so coming here, they wanted to do everything for us. So they put us in softball, and they put us in Irish dance, and they put us in music just to get us involved because they knew that you had to do so much to get into college. And having no idea how the college process worked, we had to do everything we could to try and get in. So I think it was just to get into college because we didn't know how much you needed to do.
That's crazy.
Yeah.
So you became a well-rounded person at the end of the day because of that, though.
I became a good college applicant.
Yeah.
I became one of those college applicants you read online.
Of course. If I see somebody that studied Irish dance, obviously I'm going to want to let them in.
Exactly. So
Yeah.
it's a very niche talent, but yeah. So that's what I did in high school. Very unique experience for sure.
Let me ask you this, though. When you first were applying to these schools, because you are a first-generation student, what kind of advice did you get about that? How did you really find your way to do that?
I had really great counselors and people in my life, and my sister went through it before I did. So my sister found my way for me. She utilized we were able to hire a private counselor, and she would help us with the college apps because my parents would have no idea what like the Common App or the UC application was. So that private counselor definitely helped just with deadlines, getting the essays in, kind of thinking of how to showcase yourself and how to write about your extracurriculars was the best thing that counselor did for us. But definitely counselors at school, the private counselor, and then word of mouth by friends. My favorite saying is you don't know what you need to know until you know. So asking people, what should I be doing? What are you doing? That was the best way I was able to figure it out. And it worked. And now my passion point is trying to help kids apply to college because you don't know. So
yeah. For somebody that's listening to this right now who is a first-generation student who's really confused about the process, what kind of advice would you give out to them?
Network to the best of your ability. Ask questions. Do your research. There's so much information out there and kids who have done it before you. There's people making YouTube videos about how to apply, when to apply. There's so many different web pages about how to make your college essay perfect. There's counselors at your school that are willing to help. There's older students, if you have siblings, if you have friends of siblings, there's always someone there to help, even if it takes a while to find them. It's the people that'll be there at the end of the day. So you have to work for those resources, though.
You have to.
When you find them, you will be fine.
Okay, so just always put yourself out there.
Put yourself out there, network, use people for their information, and at the end of the day, you have to. And people are willing to help, and make sure down the line you're willing to help as well. You know.
Makes sense.
So
you did that, and you had this private counselor that helped you, word of mouth from all your friends.
Yeah.
And what made you choose USC?
That's a great question. It was actually the tour they gave. So my sister, she went to Stanford, great school.
Really?
Right.
I haven't heard of it.
This small school in Palo Alto.
Oh, yeah.
Yeah.
What? Didn't Steve Jobs or something?
Yeah,
Maybe.
Probably a couple big names.
Yeah.
So my parents went on a lot of tours with her. I went with her to schools on the East Coast, like Harvard and everything. And we also did the UC tours, so I've seen it all. But we got to USC because I heard it was a great school. I didn't know much about it, though. I didn't hear it was, like, the best because of the area, but topic for a later conversation.
Yeah.
But the tour, you get into the room and you sit down in a room full of adults and other prospective students, and they're so professional. It was like a welcome speech. So he gave all the information you need to know about USC, just a presentation about what kind of stats, what's the schools like, everything like that. And I was talking with my parents, and we've never experienced a presentation like that. It was one of the best things. He was so passionate and so kind. And we got out of the presentation and went on our tours of the school. And it was a very small group of just the tour guide and a couple people. And we were able to go into classrooms and see what student life was like. And ever since that day, I was like, this feels like home.
Really?
Yeah. I've never felt at home at a place like USC until I got here. I visited my sister at Stanford, stayed with her. It didn't feel like home, but I got here and being able to see the students and interact with the tour guide like that, the type of people and the atmosphere around USC is home.
So that's a feeling that's carried on throughout
That's a
your 3
feeling
years.
that's carried on for sure. Even though I've only been here for 2 years, there's nothing like it for sure. It's the bricks and everything. It's like the American dream, you know? It's exactly what you picture college. It's picture perfect, first of all the fountains, everything, but the people, you can truly find some amazing people here. So,
did you have any doubts about coming to this school, or was it all just like, no, this is 100% for me?
The only doubts was financial, if I'm going to be honest. But other than that, on decision day, I had Berkeley and USC. And I was going to have to commit to Berkeley because the financials didn't work out for USC. But on May 1st, I was about to click submit, but I got a notification from USC. My appeal went through. So, and it worked out, and I had no hesitation. I was like, immediately yes.
Wow.
Yeah.
That's very cool.
So, every other school is great, but there's an atmosphere here. There's everything from football to the people to music. Coming from an arts high school, a school that has so much art performances and so many diverse kids, you really can't find another place like that.
You've said the people a couple times now. What is it about USC people that really draws you to them? Because a lot of people out there that haven't gone to this school, haven't really experienced what the Trojan family is like, think that we're just a bunch of like really rich, stuck-up kids who don't know anything. We're in LA, all of that. What would you say to them?
I'd say you'll find people like me where I'm not rich. That's the thing. You attract who you are, I think, in some sense. So all of my friends are like Latina, and a lot of them are first gen, and a lot of them are in financial aid and down-to-earth people. I've never had such ride-or-die friends in my entire life. So the people here, like the RAs on my team, none of them are stuck up in any way. You of course, you will encounter people like that. It does have the reputation for a reason. A lot of high-profile kids do come here, but you find your people through clubs and the major, and you stick with them for sure. So definitely good friends for life, and you find your community.
Yeah, very cool. Backtracking a little bit to the actual degree, you came in as a global health major, and then after seeing the IR classes, that kind of turned you off to it. You wanted to go to health promotion. For those out there that don't know that much about IR, what was it about the IR classes that were just like, this was not for you?
So I actually never took them.
Oh,
but
just heard of them.
I've heard of them. They're very reading intensive.
Yeah.
And you would know, you're taking an IR class right now.
I'm taking a couple IR classes.
Exactly.
They're very reading intense, very like what's happening in the world right now.
Right.
Which is interesting and it's exciting. The only complaint I have for it is it focuses on the theory side of things a lot.
Exactly.
Versus like the actual how it's implemented. So that's my only caveat.
Yeah. That's exactly why I kind of switched as well, because I didn't love the theory based of it. I didn't love the extra readings. I wanted to see, like in HP 365, you see more like human experience. It's not just pages you're reading. You have like guest speakers. You have everything else. IR just wasn't for me, and I didn't want to really go into the politics side. So I think that's great if you want to do politics and you might have a future in health policy or anything like that. I totally say global health is more for you, but if you're more on a pre-medicine track, any sort like pre-PA or anything like that, or myself who's not pre-medicine at all but wants to work in public health, I would say the health promotion major is definitely better. So they're definitely very catered, and I'm glad I found early on that IR wasn't for me. So
is that unusual, not being a pre-med student in HP classes?
It is. It seems like everyone and their mothers are a pre-med in any regard. It's always like, oh, what are you doing for pre-med? I'm not pre-med. It is quite weird because I used to be. Pre-med is definitely not for the weak, right?
No. Take that first BIS 220 class, you feel it.
Exactly. It's a wake-up call. So I dropped pre-med not because of the classes. I had a great GPA as a pre-med. It wasn't because of that. I just didn't see myself in the future being a doctor and doing those 4 extra years of school and the MCAT. I just evaluated my life. I was like, what makes me happy? And enjoying life, not necessarily in school, was something that made me happy. So from then on, I've looked into other paths and found my way.
It's important, though, because I feel that a lot of people that look at health, they just think everybody wants to be a doctor. They don't focus on the policy side. They don't focus on the administration side. All these other things that help make health what it is and help set the foundation for it, that it's important to kind of tell people, no, it's okay if you're not going to be a doctor or study medicine like that. You're still smart. You're still going to be doing great things. It's just not the right path for you.
Exactly. Thank you for sharing that perspective, because I feel like more kids need to hear that. it's really easy to get caught up in a pre-med lifestyle because at the end of those 8 years, you will be making money. You will have the title of being a doctor. And for a lot of those kids, I don't have this situation, but their parents really want them to be a doctor or be in that sort of high profile field. Which is totally understandable, but I always tell people in 30 years, it's going to be you at the end of the day. So you really have to buckle down and figure out what you like, what makes you happy, and is this life of school all the time and anatomy and everything else and the pressure of being a doctor going to make you happy? And if so, go for it. We need more doctors. But if not, then there's so many other fields and so many other things you can do with the degree you're getting. So
very, very true. And we're going to be talking about some of those career paths a little bit later. Before that, I want to ask, what is the health promotion class load really look like? And how much time out of your day are you spending studying for it?
So I think, honestly, the intro classes and the foundation classes have been harder than the upper division classes. I'm actually just taking the intro classes now. So I'm in HP 200, which is Intro to Health Promotion Disease Prevention, and also stats with you. So those classes have been more time intensive and something I've actually studied for versus the upper division one. So I've taken all my upper divisions, like HP 408, Environmental Health, 460 was Maternal Health, and those classes are a lot more group work based. So you have a group and you do presentations or you do individual presentations. It's not much studying or theory based, as you were saying earlier with the IR classes being very theory based. A lot of the lower division health promotion classes are theory based. Like, for example, in my HP intro class, it's all different models of how people communicate with one another and everything like that. So for some reason, the intro classes are heavy coursework. I've studied more for those classes than a lot of the other, honestly, pre-med classes, which is crazy, but it balances out because in upper division classes, it's lighter, intro classes heavier, so I'd say it's a bit of both, but time per week, I'd say my intro class takes up the most. They bring in guest speakers, and you have to know every single thing the guest speaker talks about for the exams.
Wow.
Guest speakers are amazing. It's from everyone from their field, from people working with issues with tobacco in Native American populations to environmental health to vaping. You hear so many different perspectives and experts from their field. It's an amazing class, but having to memorize their individual research publications or the theory behind it or also the context and the sociological perspective behind it, it is a lot. So you will have to study and do your own research and time for it. So great class, a lot of work though.
Sounds like a lot of work, but when else are you going to have that opportunity to like really dive deep and try to really understand what these leaders in these industries are doing and really seeing what makes them tick and how you could implement that down the road? Exactly.
I mean, when else in life are you going to be able to sit down and truly learn from experts in the field? I would never meet this woman who came in last Thursday. She's a lawyer in health equity. Like, I won't be ever taking law classes, but to have an hour lecture from her is great. And I think guest lectures is a very big theme in the health promotion major for sure. Because in HP 365, Professor Whitley would bring in guest speakers with their own experiences, not even in like experts in their field, but who've seen the issues of the healthcare side of things. So you hear from so many different perspectives in all of the HP classes. It not only makes you passionate about what you're doing, but it also opens your eyes to fields you would have never considered before. So it's a really cool major.
So what are some of these fields that come up that are some of the main themes of the HP classes that you guys study?
It's a lot of smoking, vaping. That's a really big one.
I feel like that's big for Whitley.
It is big for Whitley. Because I'm taking Whitley right now and my intro class, and we've had 2 speakers in my intro class talking about smoking and vaping. So right now it feels like smoking and vaping is a big one. Of course, it's a huge issue. I mean, it makes sense because it is such a huge problem within college students especially. So I think they're probably catering it a bit. Also environmental. I think that's a very forgotten field of public health in some way. People don't realize how much the environment impacts their health. like working this past summer, I was able to see exactly how much the environment impacts people's health.
Where were you working this past summer?
So this past summer I worked for the CDC. I worked for the CDC in local county health department in Washtenaw, Michigan. So Washtenaw is the county that University of Michigan's in. So it was amazing. I was able to physically test people's waters and do inspections of restaurants or well and septic systems, and you're really able to see how much public health is in every single aspect of your life. You wouldn't even think about it. It's in your toilet flushing system, it's in your restaurants, it's the invisible field, and it's so necessary. And this past summer showed me how much public health and the health around us of the environment truly impacts our day-to-day life. So, great experience.
It sounds incredible to be able to actually work with the CDC and implement some of these things.
Exactly. CDC was great. We were able to make research projects. So, for example, I collected data from every single house in the county, and I mapped their arsenic level. So, arsenic is a naturally occurring groundwater contaminant when the rocks break up in the ground. So, it's natural. You wouldn't even know if you have high arsenic in your home if you did not test for it, but people haven't been testing for it there. So my project was to make a map of the county and show the high and low levels of arsenic and send that map to homeowners and say, hey, there's been high arsenic in your area, it might be a good idea to test. So I made that map and sent my findings off to the homeowners, and months later I just got a text from my boss saying we've had more testing than we've ever seen in years before, and people are finding some bad stuff in their water.
Yeah.
Some stuff they would have never known because you can't smell it, you can't taste it. But in the future, it's going to cause it's going to cause like cancer, it's going to cause birth defects. So it's great they're testing now. So
that's so incredible, though.
Yeah.
Like, what is it like really being out in the field? Like, before you even get the degree, before any of these things, and really making a difference in the community? What is that feeling like for you?
It's a feeling like no other. It's because that project, it meant the world to me that I could send that letter out to people and they could test and prevent something that could cause them or their children's life at the end of the day. You'd never know what people might be susceptible to. You never know how it could affect them in later years. So I was able to literally promote the health and prevent disease. Putting the major into real life as an undergrad was the best experience in my life. It was so hands-on, and it was applying what I've learned from school. You learn about the social determinants of health and how everything around us impacts our health, but seeing it play out in real life, I think, is something that we miss in college. We talked about this one day, how it's hard to get real life work.
Yeah.
But once you're doing these internships or you have a job after college, you're really applying what you've learned in school to the world and your job.
I agree. And one thing I do want to applaud USC for, especially the Keck majors, is while we are learning about all these different health issues and everything like that in theory, we're also going out in groups and we're presenting these cases, ideas that we're coming up with on how to change it. So I really like that idea of taking what we're learning in the classroom and implementing it and making little changes in our own minds and actually applying that into ways that we can really help the real world.
I think I do agree with what you're saying. A lot of teachers ask for our opinions, like 320, HB 320, it's biological basis of disease. And
Ashley Bennett?
Ashley Bennett, yes. Yeah. Hardworking pediatrician.
Oh, yeah.
She's great. But she always asks us what we think. I think we have an assignment Tuesday, actually. How did COVID happen?
Sounds right.
It sounds right,
Yeah.
exactly. And she said, don't say anything else. Don't say anything that someone else before you has said. So it not only makes you think about it, you can read off of what other people think. So in that way, I love that class because you're able to think on your own and you're able to truly get down to the nitty-gritty of why public health issues are happening. So like you said, it is the world experience that we get.
Yeah. Also, that class is very special in the sense that we've spent so much time looking at the different prison systems, schooling systems, looking at how diet and nutrition play such a crucial role on your overall health and society and community health. So it's just
stress.
Stress, too. Oh my God, noise pollution is one of the biggest things that can lead to that.
Exactly.
Yeah.
It can affect your health for the rest of your life. What we're doing now is going to impact us for the rest of our life. And I think that is, in my opinion, the best thing public health serves the public for, is helping promote the health of students now and kids nowadays, so they won't have to face the health outcomes that generations before us have had.
Mm-hmm.
We're living longer, we're smoking less cigarettes at least. But there's so many different programs now aimed to serve a community like us. It's truly going to promote the health, and I'm glad that everyone's learning how much the environment impacts our health in that class.
Oh yeah. Do you feel like there are some misconceptions about the degree or public health as a whole that you'd like to address?
Do I? I think one of the biggest misconceptions is public health degree won't get you anywhere if you're not pre-med.
Mm-hmm.
Being pre-med will get you somewhere for sure. This degree is great if you're pre-med, but it can also be utilized in so many ways. Think about, since COVID, how many people have applied to the major. It's been, if you look at the statistics, it's an exponential number of students applying, because as a population, we're starting to realize how important public health is. It is invisible, like I've mentioned and I've seen, and it's so crucial to have in the future. And I think everyone and a lot of big companies are waking up to that. They're having more people on their HR teams or more mental health teams and more services and resources, and making those more readily available. So I think people are coming to public health more than they ever have before, and this is just going to keep growing. There will always be the need to serve the public. We will never be a perfect population. And I think, tying it back to the misconception, people will be applying more and more, and people will be turning to public health more and more. So it is so great to have this degree, because you can use it in anywhere. You can use it in a health department, you can work for the CDC, you can work in schools, you can still go to grad school and get more degrees. It's transferable skills anywhere. You're learning about people, you're learning about how people communicate, about health. You're learning so much about such a broad field, you can apply it to anywhere. So I think one of the biggest misconceptions is that you can only use global health and health promotion as a pre-med major. It's so much more, and it can have huge impacts everywhere.
I think that's incredibly well put, especially for people out there that don't really understand all the work that goes into it and what really is entailed.
Yeah.
You brought the point of multiple degrees and getting that afterwards. Is that a common trend with people in this major? Do they end up getting a master's or a PhD, or do most people start with just the bachelor's and then start going out into the field and actually doing work?
Right. I think in public health, I won't lie, it's going to be hard to get a lifelong job and a salary that's going to support yourselves for the rest of your life with just a bachelor's degree. So it's not like a business major or engineering degree. You probably will either have to work in the same place for a while, or maybe work in the business side immediately with a bachelor's degree. Sorry. But you probably will have to do more schooling. I'd say the most popular track is getting your MPH, so Master's in Public Health. That's a really big one. I was talking to some of my coworkers over the summer who work at the University of Michigan. They say the age of getting the MPH is actually getting later. So I think some people are starting to work right after college with their bachelor's degree, probably just to save up or make sure they like the field. But usually people will get an MPH. I'd say everyone who works at a health department has their MPH.
Okay.
PhD is, I'd say, a lot of more people doing research. So like biostatisticians or epidemiologists, and more of those heavy research majors are going to do PhDs, because it's a huge commitment. It's 4 years of your life. It's like medical school. So you have to be really, really into your subject and into your field, and kind of at the forefront of research to more so go into that track. So I'd say the most common one is MPH.
And then after you get that degree, what jobs are really out there for you? Like, very seriously, I know we always say the CDC or being like a health analyst or epidemiologist, all that, but when people are looking at the job fields they go into, what is that looking like for them?
I think the first one that comes to my head is working in a health department, because that's where I worked this past summer. There's also community organizations. So like in Michigan, a lot of my friends worked at Birth Detroit, which is a birthing center for Black mothers in Detroit. So it's a lot of like the community health organizations, it's health departments. It could be like WHO, it could be even in schools or working with big companies. You can do public health consulting. You can go into the business side.
Ooh.
You can exactly. So there's a lot of paths. It's kind of hard to pinpoint it. Like environmental health, you can go into sanitarian work, which is inspections, which is hands-on looking at well and septic systems. It's very, very hands-on. But you could also get your MPH and be an epidemiologist. You can teach, you can do consulting, that's a big one. Even if it's not business consulting, you can consult for big companies to make sure that what they're doing is ethically good for the public. A lot of people go into research, professors, so...
Sounds like you got a whole world in front of you if you want to go into this major.
It is. It's like a communications major almost. When you ask people, what can you do with a communications degree, they say, oh, it's so versatile. And that is very true for public health, I'd say, as well. Because you're learning a lot of people skills, you're learning a lot of math skills, so you can really take it to where you want to go. I know some people who are getting into CS as a public health major, because there's like, you can make hospital systems more efficient for patients. It's so many different fields you can go into.
You just have to find the crossroads between them.
You have to find the crossroads. It probably will take a bit more school, but that's, I feel, the growing trend. Like with a psych degree, you're also going to need further school. With a biology degree, you're going to need further school. So public health is the same in that regard, but so many different paths.
Yeah. And with all these different paths, do you happen to know if there's like a bit of a salary range of what people can expect once they get this degree? Or even a higher level degree in this field?
Right. So an MPH, I'd say, is probably like, it also like everything from state to what kind of job. But I'd say like everywhere from 50, 60K upwards to 150K if you're just doing public health work in a county health department. I think my director at the county health department was making like 110K, which she works a 9 to 5, only 4 days a week. That's pretty good, and she loves her job, and it's very, very hands-on, amazing work she's doing that truly impacts the community every single day. So, and she only has an MPH, and an MPH can range anywhere from a year to 2 years. So with that amount of schooling, and it's not as difficult as a CS degree and everything, I'd say that's a pretty good deal. But base salary isn't amazing, of course, but you work your way up. You can do different things like healthcare administration. You'll make a lot more money there.
Yeah.
So
because it got the business side in it.
Getting to the business side. So it's really dependent on the track. I know a lot of my mentors are like deans of public health schools or professors or faculty and do their own research, and they're doing quite well.
Okay.
So
as far as the actual masters go, I feel like if you're not pre-med, most of the options people go into, if not a completely different field, are MPH, Public Health, Masters of Health Administration, or Masters of Global Sciences. What really is the difference between the three of those? And I know which one you've chosen, so what made you choose that?
So I'd say, first and foremost, the Global Medicine one it's not as transferable as an MPH, the Masters in Public Health. It's not as well known, and MPH is sort of a baseline that you can get at a lot more colleges. Global Medicine is not as respected, I'd say, if that makes sense. It's a very amazing degree to have, and it can teach you amazing things, but it won't get you the same respect or look on an job application as an MPH would, because MPH is more rigorous. It's just more of a foundation baseline. And then healthcare administration, it's the operations of a healthcare system. So that's a lot more business. You won't be on the groundwork of it. You're going to be more managing people, making sure that a hospital is functioning correctly, looking at how many beds do you have open, how can we make things more efficient, not only for patients, but also for the doctors and all the staff underneath you. So that's definitely more operations based. And then MPH is more like epidemiologist. You're going to be working in a policy analysis. You have all of that type of work. So global medicine, I don't know of a lot of people who just get that. So I'm getting my master's in science of global medicine on a business track at USC as a progressive degree. So I'll graduate in 2024 with both, which as a first generation student, I'm deciding to do the global medicine one so I don't take more time at USC. And it's great to have those business skills early on, since I'm not really exposed to those as a public health kind of major. I would have to minor in something else. And I will be doing my MPH and healthcare administration one right after I graduate, but I don't want to do it at USC in accelerated fashion. So that's kind of the path I've chosen. I wanted to get a master's under my belt to not only say I have a master's, but to also learn those business skills, and the global medicine master in itself is better than just the undergrad degree. So it's kind of like I'd say if I were to rank them, I'd say most prestige is going to be healthcare administration, MPH, master's of science, global medicine, and then say the bachelor's degree. So kind of working myself up the ranks, doing things as efficiently and cost effective as possible since I paid for my own. So that's how it's worked out.
Why don't you want to rush the MPH?
That's a very great question. We've talked about this. For myself, and I've thought about it, I think the extra degrees and the MPH is more about the experience you're going to be getting. The MPH is the internships, it's the professor relationships you have. It's truly the experience and the work you can do in that. And I know USC would be great for that if I wanted to do that. I just didn't want to take that time and rush that experience in an undergrad degree. I wanted to truly take the time to be at a new school and have those 2 years to develop new relationships with coworkers and other students and faculty at another school and see what the public health life is at another school. So for me, it wasn't the best situation. I know some people who are doing it, but they aren't as focused on the public health field. So I want to truly take the time to establish those relationships and learn what I need to know and have as many internships as I can in an MPH curriculum 2-period time so I can be better in my career.
I feel like that's very unique since we're
is.
living in a world where everybody's trying to rush through everything and just trying to let's get the degrees, let's start making money, let's get the good job, let's get started. But you really want to take your time and make sure you know this content front and back. You're making the most out of the experience that you're there. So I think that's very interesting and
Thank you.
Kind of admirable a little bit that you're not in this rat race, that you genuinely want to learn about it.
I think that I do feel that that's a growing trend of being done as soon as possible, getting everything out of the way. It would be cheaper. Maybe it is a smarter choice for people. That's their situation for sure. I respect that 100%. Me personally, I just wanted to take the time and truly experience what it's like just being a master's student and having that transition into a full-time job. I think for me, that's going to be a great transition to learn what it's like having a full-time job and do school on top of the job. So I think for me, it's going to be a great transition period, and I really just want to focus on public health.
So if we were to imagine we are transported 30 years into the future, and you can look at yourself now, what are you hoping that you have accomplished, and what are you hoping that your new job title and everything like that looks like for you?
So in 30 years, my dream job in 10 years is different from 30 years. So this is, thank you for the number specific.
Had to make sure you knew.
Thank you. In 30 years, it's a very weird job. And people do make fun of me. I want to be a dean of a school of public health. It sounds very weird. This past summer, I was able to attend a lot of the guest lectures from the dean of school of public health there.
At Michigan, right?
Yes. Okay. Amazing man. He makes a difference there. His student body is one of the most diverse, one of the most accomplished. They're a number 1 public health school. They're top 3, but number 1 for public health. Yeah. That sounded weird. But he inspires his students. I've never felt so accepted in a school like I was at Michigan, and that was because of the dean. He makes sure that anyone going through the school or just visiting or taking classes has a home there and can truly learn, and he makes sure that his professors are very attentive to the student body needs. He offers himself individual appointments with people just passing through. I don't go to Michigan, obviously, but I had an hour conversation with him back in August when I was at USC over Zoom because he was willing to take that time out to help me in my career. So he goes out of his way for students and his professors, and he wants to make a difference, and he implements some of the best policies of admissions. He's getting rid of the GRE to get into that school, so making it more equitable and accessible to everyone. So he's an inspiration to me, and I want to be like him one day.
So it sounds like there's a bit of a shift, because when you came into global health at the very beginning, you wanted to do more community help in the sense of working with free health clinics, everything like that, and improving the system.
Mm-hmm.
But now, after going through this experience, is that no longer the main goal, or is it just a shift of, okay, I'll do that, but then the end goal is to help the incoming students and the next generation of public health students or whatever? That's
I question that a lot myself some days. I think over the past couple years at USC, I figured out community health is something that is so important, but maybe not for me. I don't know if me spending my life in different countries will make me as happy as it would changing things from the inside out. So over the past couple years, I've realized that I want to be more on an administration side and truly like the operation side to make things run smoother and become more equitable behind the scenes. So I think community health work is something I might do right after college for a year or two, but not something long term. Mm-hmm. It would definitely be more healthcare administration, like running hospitals, making sure that patients are seeing doctors that look like them or getting the treatment they deserve with as quick of wait times as we could possibly get. So I think for now, that's my plan.
Okay.
Yeah.
Fun little question for you to kind of go off track a little bit.
Yes.
If you had a magic wand and you could solve one major global health issue that everybody's facing, what is something that is close and dear to your heart that you would want solved?
That's a hard but amazing question. I'd say healthcare. That's such a blanket term. It's so expensive here, and people are losing their lives because they don't get the necessary checkups they need because they don't have proper insurance. That's a huge problem, and it's going to take a while to make a change. So if I had to get more specific, I think right now one of my big passion points is the price of medicine. So pharmaceuticals, things like big pharma and everything, making prices insane. It's killing people. People who have diabetes can't even afford insulin. The price of insulin is like $200. And think about it like this. These people have a condition they cannot help. People with type 1 diabetes, you cannot mitigate that as you can make self-improvements for type 2. They have no choice but to buy this medication. It's like every other disease with cancer. You can't help that you're getting cancer, and having to work extra jobs, having to take out loans, having to start GoFundMe and ask friends and family to donate to you to get medicine to save your life, that's absolutely insane. And it's killing people, and it's
it's crazy.
I can't wrap my head around it.
It's really screwed up at the end of the day.
Exactly. Yeah. It's another big problem, like healthcare, making that price better for all, but that one, there needs to be more regulation. It's absolutely insane. So I think that's one of my bigger passion points, the price of pharmaceuticals.
I love it, yeah. Very passionate about it. Look at you. No, 100%.
Yeah.
Makes sense. Going back to the student experience again, you are involved in quite a few social activities here on campus. Just to refresh our viewers' minds, can you name a couple of those?
Of course. So I think a social aspect, I'd say, is I'm involved in Greek life here. And I'm also a Keck Student Ambassador, not necessarily as social. And I'm also an RA, so resident assistant, which is my favorite one of all.
Everybody's favorite people on campus.
Everyone's favorite people. You said it better than I could say myself. No, they learn to love us.
Yeah. Over time.
Yeah. So those are great. I've loved those experiences. I think the most, honestly, it sounds very weird, the most public health related one I'd say is being an RA.
Really?
It sounds weird.
How so?
Because the health of our residents is our job. So checking in with them, how are you doing in school? How's your mental health?
Gas leaks.
Whoa. Gas leaks, exactly. There could be things where residents text me, hey, I think there's a gas leak. Oh no. I don't know what to do here. No, I'm kidding. So it's the health of the building. Like one time, a man who was very, very high, it was meth, it was later found out. He's a worker at USC in the village. He broke into the building and he was riding up the elevator with us, and that moment when I was the person who had to get him down, because I'm the RA, I'm the one who's responsible for the health and safety of my residents, having to bring this man down and get DPS was a very scary moment. But in that moment, I was like, oh my god, this is kind of a public health job.
Yeah.
My residents are the public, and I'm helping their health.
Very true.
Health and well-being.
It's a stretch, but I see it.
It's a big stretch for sure.
Yeah.
But you can make that connection.
I feel like that's a good segue to go into a little bit about the neighborhood and environment around USC. Is that something that you see quite often?
There definitely are homeless people. The area, of course, is not the greatest, but it's a lot of people who do not go to USC are very over dramatic about it. Oh my god, you're in this part, how are you still alive? Or why would you ever go there? Honestly, I haven't, thank God for this, I'm very grateful for this, I haven't experienced anything bad ever. Of course we do get the Trojan alerts, and my friends probably have their experiences. This is just my personal outlook. I feel safe on that campus. We do have the free lift and everything, which is a great help, but...
For those of you who don't know, we get free lift after 6 o'clock or something
6
most
p.m.
days?
to 2 a.m.
Within a 2-mile radius of the school.
2-mile radius. So I'm able to, I Ubered here tonight, and I could have walked. I probably wouldn't be the best decision. That's a long walk, but...
It's like a mile, yeah.
It's also, in certain areas you definitely don't want to walk
Dark
alone.
in South Central LA.
Yeah, exactly. So USC does have its measures. They have the yellow jackets, although they don't do much. Their presence standing there on the corner, I think, speaks for itself. It kind of deters people from wanting to do anything bad. So I think it is safer than some people like to say that do not even go here. But for my friends, as a girl who has more than once walked alone to 3 blocks away, I felt okay about that.
Good.
So
you should. This is your home.
Exactly.
You shouldn't feel unsafe here.
Exactly.
And I think that's a good point to bring out. That while it is a more impoverished area, especially at some places, overall I think it's working on improvement, and we don't feel unsafe. Little things do happen, but to be honest with you, some of those things that happen are because people are being idiots.
Yeah.
There was this one notification we got that somebody got their wallet stolen by a kid on a bike, because the young lady was holding 3 boxes of pizza and had her wallet and phone on top of the boxes, and somebody just ran and grabbed it.
Exactly. So I think being aware of your surroundings and learning how to be responsible is, one thing every college student has to learn going into college. So I think it's not as bad as people say. It's really not. And USC does do its part to make it as safe as possible. I can't enter the village back at night without showing my ID. And I had a friend visit this past week, and I had to fill out a whole form for her just to be able to enter the village at night. So
wow. So it's very strict.
It's very, especially in the village and on campus. I can't speak for off-campus housing because I've never lived there. So I think my perception is also a bit sheltered in that sense.
Yeah. As far as Greek life goes, I know that's something that a lot of people are curious about, especially managing it with a health major at the end of the day, like a bachelor's of science. What has that experience been like for you? And is it easily manageable?
I think being in Greek life as a girl is a lot more manageable than being a guy in Greek life. So I joined it for the friends aspect. Coming here during sophomore year was the first time I was on campus, like a lot of other kids, because freshman year was online because of COVID. That was a great social aspect. Met a lot of people I would have never before, like business majors or cinematic arts majors. I don't know when else I would have met them. So in that aspect, it's been great. It hasn't been a lot of work. We only have mandatory things once a week. I think it might have been a bit more last semester, but overall now you go to what you want and you don't go to what you do not want to. So I'm not as active anymore, but I still go to the bigger things. Okay. So it's been a good experience. They're very into St. Jude. I'm very into the philanthropy stuff, so I enjoy that.
What has it really added to your life and your overall college experience?
Added to my life? I'd say, honestly, just the social thing. I've, like I said, met a lot of new people. I've experienced a sorority at one of the biggest Greek life schools. I think that's been a great experience, especially because my parents didn't go to college, I never knew what a sorority was like. So I wanted to experience that first and foremost. Added to my life, I think it's brought me balance. So as an RA and doing school, you're constantly dealing with residents, you're doing homework. I live where I work. So a resident can text me at 10 p.m., hey, I need to talk. And it's my job to be there for them. Although I'm not on duty, it's still my job as a person and as their RA. So in that regard, I constantly am working, and I'm doing schoolwork on top of that, and all the other, like, applying to jobs. So that's a lot all the time. But this Greek life is a great opportunity for me to meet people and connect with people I would have never experienced, and I have great friends in it. I found people who are like me, who are, like, Latina. It's not as crazy as people might expect. You do find people like yourself, but that's a different conversation.
Yeah.
But it's provided me balance. I'm able to go out and see people on Friday and Saturdays. I'm able to get away from my campus building because that's where I work too. So when I go out to the Tri Delta house for a meal or for a social event, it's a break, it's balance, it's for me. So that's the biggest thing I've gotten out of it. Because I would be working all the time. I know myself. And I would push myself into school. So I'm like, no, you need to stop and go see some friends.
No, striking that balance is very important, especially with all the things that you're doing. You definitely have one of the heaviest workloads out of anybody I know, apart from just school, but adding all these extracurriculars and everything to it.
Exactly.
What's one thing that you do that just helps make everything okay? Like, helps you manage it, helps you just really be like, I'm doing this out of a love for it, and it's okay, one day at a time.
For public health and school?
Everything. Just everything for the overall college experience for you.
I think I learned this past summer, it's really, really easy to get off track, and it's especially in a field like public health when it feels like you're doing so much for such little change. It's very, very deterring. It's really hard to stay focused. So they taught us, they said, write down a paragraph about what is your why. And they said, write down every single reason you're in this major. Why are you doing these classes? Why am I doing certain stuff? So on days that you're like, this does not matter. Why am I doing this? You can look at that and say, I'm grounded now. I'm realizing that this is all for a purpose. Every single little thing, although it feels like a ton of time, sitting down and writing a 20-page paper last weekend, I'm like, what am I doing this for?
Let's look up the why again.
Let's look up the why. I think about it, and I think to myself, I'm going to be able to do so much in my career. I'm going to be able to change a system that I was affected by as a child and that I've seen my entire life hurt people. So many people have died from it or had very bad health outcomes because of this system. There's so much change that needs to happen, and I know I'm very passionate about making that change, and I know I can make that change if I put my mind to it. So doing these papers and learning as much as I can, if temporary pain, temporary pain, forever gain, you know?
It's like a moment of pain for a lifetime of pleasure or something.
Exactly.
Like that.
So I do it for that, and I do it for my parents for sure. So like I will always talk about being first gen. It means a lot. Like my mom has 10 siblings, and out of everyone, me and my sister are the first ones to go to college. I have 35 first cousins that live in my hometown. So it's for them, it's for me, it's for the future I can impact. As cheesy as that sounds.
That's so motivating, though.
Exactly.
Like, I'm getting motivated and hyped up right now just listening to you, saying what you do, your reasons for doing it, and just, like, the real drive behind it that not a lot of people have. Like, it's very motivating.
Thank you.
And also, you and your sister go to incredible schools, too. It's not like just, like, any random college. Stanford and USC as first gens. That is incredible and a testament to the amount of work that you guys have really put in and this dedication that you have. So I know you do appreciate it, but I really do want to highlight that fact.
Thank you.
You're incredible for that.
Thank you. I mean, we could not have done it without our parents, though.
Yeah.
My parents on late nights would bring us to dance practice, helping us make our college applications perfect, doing all these activities because they wanted to set us up for a life they couldn't have. So there's so many other kids like me, even like you work so hard and you have that drive. So It's possible, and it's so many people have helped us though. So I'm very, very grateful for that.
We're nothing without the community around us.
We are nothing without the community around us. And like you're doing with this podcast, you are creating a community and helping people who might not have it. So as someone who was first generation and had to use that word of mouth trick and had to network and had to scrape at resources, you truly are making an impact with this. I would have loved to have something like this, so you did a great job with
Thank
this.
you. That's the main goal at the end of the day. Help the people that don't have that information.
Exactly.
I think it's a perfect segue to this next and final question.
Okay.
If you can give advice to anybody out there that's listening, first gen, any college student, or even freshman year Gianna, what kind of advice would you give them to do well, to feel safe and at home at this school, and to overall know that it's going to be okay?
That's a good question. I'm trying to think about one of the best things that would have helped me. I think putting yourself out there to not only utilize the resources, but also utilize the people around you, not only in a academic way or getting a job, but there are so many people here with diverse perspectives and different majors and different ideas that you can grow from, you can learn from and bounce ideas off of. But there's also so many resources at USC. I did not know about them until I was an RA, but we have a whole training on every single resource. I have never heard of half of them, but they are amazing. There's like wellness clinics, there's different personal dietitians you can get mindfulness coaching, you can have a personal life coach here. People do not know about this, and there's so much to tap into at USC, but you have to put yourself out there to connect with it. You have to have that drive, and you have to know your why of what you're doing stuff to access everything. So advice would be utilize the resources and people, but also know why you're doing it. Know why you're here, and realize that this is a great school, and you are lucky to be here. Of course, everyone knows that, but internalize that and make it count. Work hard.
Be very grounded in that.
Yeah.
Make sure that you understand there's a bigger picture at the end
There's
of the day.
a bigger picture. College is temporary in some ways, so put in the work now to benefit later. It's like it truly is an investment.
It really is. Investing 4 years of our life, a lot of money.
Exactly. It's a long 4 years.
It is.
I won't lie. But
it feels like it's gone by kind of quickly now, though.
It has, especially as we're getting old.
Yeah. Juniors.
I know.
Scary.
Exactly.
Well, Gianna, I want to thank you so much for taking time and sharing your story. It was incredibly inspirational. To everybody out there who has any more questions, I will link Gianna's socials. You can message her. I'm sure she will love to hear from you. Of course. It's the RA mindset at the end of the day.
Please reach out.
Yeah, more children, huh?
Yeah.
Yeah, there you go.
Network.
Network. All right. Good night, everybody.